Let's say hello for everybody once again. We are starting the lecture of basic and clinical pharmacology now, and here we have, for now we have 10 students, okay, 9 students in total, and now we have 11, 12 students, okay, so they are joining later on too. But now what I need to do is I need to continue with our lecture here. And there is a presentation I have prepared it from the adrenergic antagonists and sympathomimetic drugs. Okay, so here we have now. I like my own Zoom app and really get used to it. This is really nice. Okay, now here let's continue then. There are too many students entering, accepting everybody. Okay, so here we have now adrenergic antagonists and sympathomimetic drugs. Okay, but what does adrenergic mean? Okay, there are some special types of receptors which are responsible mainly, which are related with the blood pressure. Okay, mainly heart rate. Okay, another one, and there are many different types of adrenergic, and we have already classified them in the previous practice classes too. You need to also have brief information on them too, and also if you have studied from them, from the book of Katsum Pharmacology, I have shared it with everybody. You need to have this book. Okay, you can download it. It is available online. Okay, now and sympathomimetic drugs. Now all types of drugs which mimic the actions of epinephrine or norepinephrine. Now they are considered as sympathomimetic drugs. Okay, now there are also now epinephrine and norepinephrine similar antagonists too, and the structure is very similar to, and they are also considered in sympathomimetic drugs. Okay, in the class of sympathomimetic drugs. Now let's continue here. So in an introduction part, now there are some students who are turning on. They are turning on their sounds. I am turning off everybody's sound. Okay, because this is the lecture, and the lecture should not be disturbed. Okay, now I am turning off everybody. I hope that my voice is clear for you, and we are going on. Okay, guys. Here we have for now 60 students, but if there will be more than 100, you could not be entering this class, but I will be uploading it to the internet later on. Okay, they will be watching the same lecture, but only after some time. Okay, and because when I only upload it to the internet. Now let's continue here in the introduction part. In clinical therapeutics, non-selective alpha antagonists are used in the treatment of pheochromocytoma. Okay, and this is the type of disease now, which there will be when there will be tumors occurring in the medulla, adrenal medulla. Okay, inside of the adrenal glands, as you know, there is an adrenal medulla. Okay, in the center. In the central part of the adrenal glands, there is a place in the adrenal medulla. In that part, when there will be tumors and this type of action, now this type of disease will be named as pheochromocytoma. Okay, pheochromocytoma results in a really high production of epinephrine and norepinephrine too. Okay. Now, when there will be an epinephrine and norepinephrine in a higher amounts in our body, it will result in many different changes. Okay, but the main ones, what needs to be learned is that it will really increase the heart rate. Okay, so heart rate and breathing, breathing speed will also be increased too. Another one, the tension, hypertension will be observed. Okay, now hypertension is the condition, and you should know also that this is the increasing the of the blood pressure. Okay, now let's continue here. Uh, and alpha 1 selective antagonists are used in primary hypertension and benign prostatic hyperplasia. Okay, we have already considered about and hypertension. They are what they are used now. This type of antagonists, alpha 1 selective antagonists, are used for the treatment of this hypertension. Okay, and there is a BPH. Now, BPH is benign prostatic hyperplasia, and this is the disease. Okay, now hyperplasia means, and this is or hyperplasia, and this is the disease where there will be a really high production of tissue. Okay, when there will be a high production of tissue, there will be a blocking of that parts, and blockade will be occurring. For example, blood cannot pass, or for example, urine cannot pass through the urethra. Okay, and similar type of things. But when there is a prostatic hyperplasia and the urine, people cannot urinate. Okay, it will be collected inside of the urinary bladder. Okay, and let's move on here. Beta receptor antagonist drugs are useful in a much wider variety of clinical conditions and are firmly established in the treatment of hypertension is one and the main one we'll be considering. And another one is ischemic heart disease and arrhythmias. Arrhythmias is the condition now where there will be problems with rhythm of heart. Okay, rhythm of heart will be not in a proper way. Okay, so endocrinologic and neurologic disorders are also being treated with these antagonists, adrenergic antagonists. Another one, glaucoma. Okay, what is the glaucoma now? This is the blindness, eye blindness condition now. And when people have glaucoma, what happens is, inside of the eye, and there will be a pressure increased. Okay, in an increased way, because of the fluid will be entering into the eye, and this fluid will be doing pressure. Okay, will be applying the pressure into the nerve cell, and the nerve cell that accepts the image from the outside, and this when this nerve cell is being damaged, let's say, the image cannot be properly seen. Okay, the image will not be delivered to the brain. Okay, when if it works correctly, it will be taking the image, okay, and delivering it to the brain. Okay, now here when initial symptoms of glaucoma, how does it occur? Initially, people will not be now seeing or feeling some type of distortedness in eyes, but later on they'll start to feel black black spots or black parts now from the edge parts of his vision, of his or her vision. Okay, now and from the edge parts there will be a black sides appearing, and later on these black parts will be increased the amount of now the image now the vision side will be decreased later on, okay, and at the end, if the patient does not take any medicine or do a laser and or surgery type of things, he will become blind, okay. And other conditions are also we'll be discussing too. There will be different types of antagonists for different types of diseases. We will be considering them too, okay. But I think in this lecture we will be having only we'll be having what no we'll be considering alpha receptors, okay, alpha antagonists. The beta antagonists will be considering about them too, but only as introductory part. But later on, the beta antagonists also will be refilled with the lecture too, okay. Now I will similarly I will upload in this similar lecture and upload it to the YouTube. I think I will upload it to my YouTube channel. You'll be able to watch that videos too, okay. So let's move on here. Mechanism of action of alpha receptor antagonists, okay. Alpha receptor antagonists may be reversible. Now the mechanism of action is similar, okay. What does antagonists do? Now when they bind with the receptors, they blockade the activation of that receptor, okay. All the antagonists work in this way, so it will be deactivating. We can say that it will be deactivating the cell in certain types of functions, okay. So now alpha receptor antagonists may be reversible or irreversible in their interaction with these receptors. Now there are reversible ones. Reversible antagonists dissociate from receptors, and the block can be surmounted with sufficiently high concentrations of agonists, okay. But there are also irreversible drugs that do not dissociate and cannot be surmounted too. So we have two different types of these alpha receptor antagonists, okay. So there are other students too. Let's move on then. Here is the picture that I have taken from the book, okay. The book of Katsum Pharmacology, figure number 10.1, okay, 10-1. Structure of several alpha receptor blocking drugs. As you see, when we are looking to their structure, what do they have is they contain benzene ring, and they contain this ethyl group 2, okay, ethylamine group 2, okay. Now benzene ring, and here is also amino group, and amino group is in here. Another one, prazosine. Now here they contain benzene ring in a similar way, and some of them contain OH, and some of them do not contain OH, okay. So when the ones which contain OH were considered as what? They were belonging to the class of catecholamines. And another one, when there were no OH in there, it was considered as in the class of non-catecholamines, okay. So let's move on here. These are the main antagonists, alpha antagonists, alpha adrenoceptor antagonists, you can say. So we will be all these drugs. Will be looking through them, and we'll be telling what type of disease do these drugs cure, okay, or used for what type of disease treatment, okay. Another one here, pharmacologic effects, and now it will be affecting the cardiovascular system here. Cardiovascular effects will be included in there, because arteriolar and venous tone are determined to a large extent by receptors on vascular smooth muscle, and alpha receptor antagonist drugs cause a lowering of peripheral vascular resistance and blood pressure. Okay, so it will be lowering the blood pressure. There are 5 more students entering. Okay, then, and here other and cardiovascular system, it will be lowering the blood pressure. We have talked about it. There is a figure number 10-3 here, and you can look it out from the book. And I have already talked about the book, Katsum Pharmacology book. Okay. Now, do we have more students? Yes, there are the students entering too. So, what are the other effects that are used with these alpha antagonists? Now, what do they do is they blockade of receptors in other tissues, elicits meiosis, okay, and small pupils and nasal stuffiness, okay. And now, this is what small pupils. Well, now what, and we have already talked about the mydriasis, but this is the reverse version of mydriasis, okay. And nasal stuffiness, about the nasal congestion, we have already talked about it. And here is the reverse version of it will be occurring in 2. Okay. Now, alpha 1 receptors are expressed in the base of the bladder and the prostate, and their blockade decreases resistance to the flow of urine. Okay, so it is used mainly for the urinary bladder. Now, people who are struggling with urinating. Okay, and now here alpha receptors when they are blocked with their antagonists, and they decrease resistance to flow of urine. Okay, and so now the urinating process can be stopped, but otherwise the muscles of urinary bladder will be contracting easily. When the muscles will be contracting more, what will be going on is the urine will be easily going out from the body, okay, from the urinary bladder. Now, alpha blockers therefore are used therapeutically for the treatment of urinary retention due to prostatic hyperplasia. Now, we have already talked benign prostatic hyperplasia is the condition now where there will be a growing now increased abnormal increase in the tissue amount. Okay, so the tissue will be increased in that area, in the area of prostate. Okay, so inside of the urinary bladder, in the ureterus. Now, individual agents may have other important effects in addition to alpha receptor antagonism. And now, about the other effects and other important effects, you can look from the book too, but the most important ones are here, and we have considered already them too. Okay, and let's move on to about the antagonist of phenoxybenzamine. Okay, phenoxybenzamine. This is the drug which is usually given orally, starting with dosages of 10 milligrams a day and progressively increasing the dose until the desired effect is achieved. Okay, so now 10 milligrams, we are starting from 10 milligrams because some people may have now they may not, their body may not like this even this amount of dose, and that's why starting from the lower concentration and increasing to the point where it will be maximally effective. Okay, and a dosage of less than 100 milligrams a day is usually sufficient to achieve adequate alpha receptor blockade. Okay, now mainly it is how much? It is 550 milligrams a day uh, would be enough for the average person. Okay, but even there are also people who use 100 or even more in order to be effective for this drug. Okay. Now, the major use of phenoxybenzamine is in the treatment of pheochromocytoma. Now, we have already talked about what is the pheochromocytoma. Now, the appearance of tumors in adrenal medulla. Okay, when tumors are being created in there, there will be a pressure occurring. Now, you should not confuse with ganglioma. Okay, ganglioma is different, and pheochromocytoma is different. Okay, ganglioma is the condition when there will be a tumors occurring outside of the adrenal gland or adrenal medulla. But in pheochromocytoma, it is the tumors occur inside of the adrenal medulla in the adrenal medulla, okay? Which results pheochromocytoma results in the increased production of epinephrine and norepinephrine. Now, people who are struggling with this pheochromocytoma, what they have increased heart rate all the time, increased now tension, now blood pressure is very increased. In other words, they have hypertension. Okay, so there are also different types of symptoms. Now, the main ones are the ones that I have considered. Okay. Now, most adverse effects of phenoxybenzamine derive from its alpha receptor blocking. Wait, guys, I have accepted another students too. They are entering. Okay. Now, 96 students, very good. Okay, and the attendance is good, but I'm sure that it may even increase to 100. Okay, when there will be 100. You will not be able to enter. Okay, but I will be uploading it on the YouTube channel. You will be watching it from there. Okay, no need to be worried about that. 100 is in here, 99 and 100. Now, first time I see this type of thing actually. Now, most adverse effects of phenoxybenzamine derive from its alpha receptor blocking action. Now, the most important are orthostatic hypotension and tachycardia. Okay, hypotension. Now, it will result in hypotension. Now, and the people who have hypertension need to be done their in blood pressure needs to be decreased. Okay, so in order to decrease it, phenoxybenzamine is used, and which results in hypotension and tachycardia too. Okay, nasal stiffness can occur too. So let's continue here. Another one is phentolamine. Okay, phentolamine, and this is the antagonist at both alpha 1 and alpha 2 receptors. Now we have already considered about the types of alpha receptors. Alpha 1s work together with GQ proteins, and alpha 2 receptors works together with GI proteins. Okay. And let's move on here. Phentolamine's principal adverse effects are related to compensatory cardiac stimulation, which may cause severe tachycardia, arrhythmias, and myocardial ischemia. Okay. Now, this type of they are all related with heart rate. Okay, so the heart rate balance should be kept, and in order to do that, the phentolamines is used now, but it has also adverse effects too, which cause these results, okay, this type of symptoms. Phentolamine has been used in the treatment of pheochromocytoma similarly as what phenoxybenzamine, and in addition, it is sometimes used to reverse local anesthesia in soft tissue sites. So, in order to give what for the local part of the body, there can be given an anesthetic substance, this phentolamine, and for soft tissues. Now, local anesthetics are often given with vasoconstrictors that slow their removal. Okay. Now, vasoconstrictors are the substances, as we know. When the vasoconstriction occurs, there will be a narrowing of the blood vessels. When there will be a narrowing of blood vessels, and the substances that were entered to the body will not be flowing away easily, because they need to have the action going on at that area. Okay, and what's the action? What type of action we are talking about? The local anesthesia. Okay, so let's continue here. Another one we have is prazosin. Okay, now prazosin, this is a competitive piperazine quinazoline effective in the management of hypertension, and it's also used in hypertension and increased heart now high blood pressure. Okay, highly selective for alpha 1 receptors, and typically 1000-fold less potent at a alpha 2 receptors. Okay, so there will be a selectivity of spatial types of drugs for spatial types of receptors. We have already talked about it. Now, and there will be in the book also you can find out. Now, in the book you can find out that there is a selectivity now, selectivity for the spatial types of antagonists too. You need to revise all this chapter from the book. Okay. Now let's continue here. Prazosin relaxes both arterial and venous vascular smooth muscle, as well as smooth muscle in the prostate, due to blockade of alpha 1 receptors. Alpha 1 receptors are also found and located in the muscles of prostate. Okay, so when there will be a blockade of alpha 1 receptors, they will be keeping their urine easily, because their muscles will not be contracted too. Okay. Now let's move on here. Tirazosin. Okay, tirazosin. Another reversible is another antagonist we are talking about, and this is another reversible alpha 1 selective antagonist that is effective in hypertension, and mainly they are used for the hypertension conditions. Also approved for use in men with urinary retention symptoms due to benign prostatic hyperplasia (BPH). Now, these types of diseases we have already learned about them too. Okay. Tirazosin has high bioavailability, but is extensively metabolized in the liver, with only a small fraction of unchanged drug excreted in the urine. About the bioavailability of substances, of drugs, the last 10 minutes we have. Okay. And there is a special table in the chapter. Now, for the tirazosin, it is high. It has high bioavailability. Now, what does bioavailability mean? Okay, So when the concentration of the blood now, if the concentration of the drug in the blood will be really high, it means that bioavailability also will be high. Okay, and now concentration of the substance inside outside of the body divided by the concentration of the drug inside of the I'm sorry, the concentration of the substance of drug which is found in the blood divided by the total body. Okay, so it means that so if it will be 1, if it will be equal to 1, it has all of the substances, or you can say if it will be 100%, it means that it will all of the drug are found in the blood stream. Okay, they are found in bloodstream, and none of these substances are not they are not in the tissues or in different types of places in the body too. Okay, let's continue here. Now with only a small fraction of unchanged drug excreted in the urine. So some part of this drug is being excreted in the urine without any change to. Okay. So now about the epinephrine or norepinephrine, for example, and the property of them is what they have. People cannot take this type of agonists just as orally. Okay, why? Because in an acidic medium it will be broken down, so it will not be having any effect to the body. Okay, and that's why what do people do is they now they enter now, how do we say, they inject the syringe in their thigh. Okay, thigh. So they will be feeling pain in there, but when it is entered through that part, it will be very effective. Okay, so for example, when people are when people are in shocked condition, they need to take this they need to take this epinephrine. Okay, and it will be helpful for them. Tirazosin we have considered. Okay, and doxazosin. Okay, this is the drug efficacious in the treatment of hypertension and benign prostatic hyperplasia. Okay, it differs from prazosin and tirazosin in having a longer half-life of about 22 hours. Now, and some drugs may have longer half-life. Now, what does half-life mean? And now, after let's say 22 hours, the doxazosin amount inside of the body will be reaching half of its initial concentration. Okay, so another one, there is a tamsulosin. Okay, this is the competitive alpha-1 antagonist with a structure quite different from that of most other alpha-1 receptor blockers. Okay, the drug's efficacy in BPH suggests that the alpha-1A subtype may be most important as a subtype mediating prostate smooth muscle contraction. Now, the last 5 minutes, actually, I think we will be finishing at that time too. Okay, and recent epidemiologic studies suggest an increased risk of orthostatic hypotension shortly after initiation of treatment. Okay, here recently recognized and potentially serious adverse effect of oral tamsulosin in patients undergoing cataract surgery is that they are at increased risk of the intraoperative floppy iris syndrome. Okay, about this disease too, you can search it out from the internet too. and also this antagonist has tamsulosin 2, okay, characterized by the billowing of flaccid iris, okay, propensity for iris prolapse and progressive intraoperative pupillary constriction will be occurring. Pupillary constriction, we have already talked about them, and the pupils become smaller in size, not because of what? Because of alpha 1 receptors are being blocked by the antagonist of tamsulosin. Okay? Now, these effects increase the risk of cataract surgery, and complications are more likely in the ensuing 14 days if patients are taking these agents too. Okay? Now, there is the 101th student. He wanted to join, but I think he cannot join now because we have reached the limit amount of students. And here we have another antagonist, yohimbine. Okay, this is the alpha 2 selective antagonist. It is sometimes used in the treatment of orthostatic hypotension because it promotes norepinephrine release through blockade of alpha 2 receptors in both the central nervous system and the periphery too. Okay. Now, there are some special types of antagonists. That type of antagonist can work, can be having they can have affinity for different types of the receptors too. But for the spatial ones, for the certain ones, and it may have higher they may have higher affinity, but they may have a little bit lower affinity for another type of receptors too. Okay, so it may, and that's why it will be having what side effects. Okay, side effects will be produced from these type of conditions. Okay, the same drug may be also activating or deactivating another types of receptors too. So another one, it was once widely used to treat male erectile dysfunction, but has been superseded by phosphodiesterase 5 inhibitors like sildenafil. Okay? Now, yohimbine can greatly elevate blood pressure if administered to patients receiving norepinephrine transport blocking drugs. So it is also used in veterinary medicine to reverse anesthesia produced by xylazine, an alpha 2 agonist used to calm animals. Okay. Now, reverse anesthesia will be occurring. Now, clinical pharmacology of these drugs of the alpha receptor blocking drugs are what pheochromocytoma. There are too many different substances used for the treatment of them, but the most effective one here I have found now written them. Phenoxybenzamine, okay, another one. And it's also methylacin. For the hypertension emergencies, labetalol is also used too. Okay. Chronic hypertension, the members of prazosin family is used. Now, about these parts, you need to study by yourself. I will be sharing with you this lecture with this presentation now, okay? And actually, that's it for today, everybody. I hope you understand everything out of these videos. As everybody, take care of yourself, okay? And we have less than 1 minute. I will be checking the attendance also from the chat too, that you were writing your names and surnames in there. There are 138